We have about 50 million people that have no health insurance. We have people who are being denied health care every day. 14,000 people every day lose their health insurance in America. We have people who are filing bankruptcy today because they can't pay their hospital and doctor bills. So I'm glad the President did this. It was a good exercise. I hope it leads to the two sides coming together. Now, first question, what is the reasoning behind mandating the purchase of health care services? If we're going to accomplish health care reform, we have to reach out to people who don't have health insurance, people who have health insurance that isn't very good. If we're going to be able to have people buy insurance across state lines, if we're going to make it so that insurance companies can't deny coverage because of a pre-existing disability, like your kid has diabetes, or you have acne, or you're a woman, healthcare costs for women 40% more than for men, we have to make sure that people have health insurance. And remember, this is not something that they can't keep the insurance that they have. If people like the insurance they have now, they can keep that. We're just making it so that everyone has the opportunity to get health insurance at a reasonable price that's affordable. That's why we have to mandate that people are covered. Another question I got from YouTube is as follows. Do you believe that health care is a right? People who are charged with the most serious crimes known to man are entitled to a lawyer. Many, many times, a free lawyer. But yet, if someone is born with a cleft palate, if someone is born with a debilitating disease, if someone gets sick or hurt, in America, they're not entitled to health care. I think it's a right. It should not be a privilege. In America, this rich country that we love so much, health care should be a right. Every person in America should be able to go to the doctor or hospital when they're sick or hurt. Another question we have from a YouTube viewer is, what is being done to address malpractice costs? Secretary Sebelius has a pilot program that she has initiated. This pilot program gives resources to states to come up with innovative ways to address this problem. We thought so much of the approach that had been suggested by the White House that we put a version of that in our bill. That is, states will be able to be given money, in fact, $250 million, to take a look at what they can do to address malpractice problems as they see in a state. And we believe that it should be done by states. The practice of law in this country is dominated by states, and that's the way it should be, because there are different problems in different regions as it relates to products liability and many different things, including malpractice. So I think we're headed in the right direction to address a problem that people are very concerned about. One of the good questions we got from the YouTubers, why not allow insurance providers to sell across state lines? We allow that with our bill that passed the Senate. We did it because we believe in competition, and there has to be minimal controls so that it doesn't wind up like credit card companies. See, we had a bill in the past that said they could set up business any place they wanted in any of the 50 states. And so they went to the states that had limited controls, and they took advantage of the consumers across America. That's why we had to change the law. So I think we're going to get it right this time. Sure, you can sell across state lines, but we're going to have adequate controls so it doesn't wind up like the credit card companies taking advantage of the consumers. The final question that I've been asked is a good one. Why are these bills thousands of pages long? The only business in America that's not subject to the antitrust laws of this country, other than Major League Baseball, is the insurance industry. We have to make sure that we are able to plug all the holes, all the loopholes that they have used over the years to avoid paying the bills that the American consumers deserve having paid. Now, if you want to talk about the size of the bill, no one today is concerned about how big the Medicare bill was. No one is concerned about how big the Social Security bill was those many years ago that has worked so well. So we want to make sure that the legislation we pass is right, not how many pages is in it. I hope that my response to these questions has been something that has been helpful to you. Healthcare reform is important to the American people. Doing nothing is not an option. We cannot let this go on and on and on. We've been trying for 50 years to reform health care. We are so very close to doing that, to allow the American people to be able to go to the doctor when they're sick or hurt, not have to file bankruptcy because they get sick or hurt. We're very, very close. What the president did today opens up doors to allow the Republicans to come and work with us, to allow Democrats to work with Republicans and independents. We look forward to completing this legislation, and with a little bipartisan work, this will be done.